Here at Covenant Community Care, we believe that God sees us, that from His heart flows a mighty stream of compassion, mercy, and justice for every human being, regardless of whatever situation or condition that they may find themselves in.
There are many people in Detroit who do not have health insurance. There are many people in Detroit who have health insurance but can't afford their co-pays or their co-insurances. And there are many people in Detroit who have health insurance or have Medicaid and don't know where they can go to find a doctor who can meet their needs. Covenant Community Care is meeting needs for people across that spectrum, as well as oral health care and behavioral health needs that often go unmet even when you have insurance.
We have grown very quickly to 9 chairs at Michigan, 6 chairs at Maross, and a very busy mobile program. Love comes first for us means this is truly a family, whether we're talking about each other or our patients. We wrap our arms around them physically or just emotionally. We give the highest quality of care that would rival any private practice for very little dollars to cost to our patient.
Many times people go to the emergency room in severe pain and all they get is a painkiller. They don't get the underlying root cause addressed. Oftentimes people without dental insurance who have teeth that could be salvaged, all that's available to them is to have the tooth pulled. And that's not good medicine. It does get them out of pain. It does stop an infection, which is important. But the restoration of the person is part of our goal at Covenant Community Care. And when we can save teeth, we need to do it.
I would say our biggest challenge in dental is the need. Even though we have 2 fixed clinics and a mobile program that can see tens of thousands of patients each year, we still have patients calling every day that we can't accommodate. We can take someone who comes in pain and alleviate their pain by either doing a root canal or an extraction. And then we get to do the fun part, which is creating smiles through dentures, partials, and crowns.
You see that smile, and to let that person go home and show that smile to their family is why our dentists come to work.
I love what I do here. I knew it from the day I walked in.
I want to bring attention to a person who came one Friday evening. When we were closing down the building, a young woman came in and she was desperate. She said, "I really need help. I just got out of jail. I'm staying with my uncle. My baby is with my baby's daddy, and I haven't used drugs since I went into jail. But I know I'm going to use them again soon if I don't get some help. Is there somebody here who can help me?" We didn't have substance use counselors. We didn't have doctors trained in prescribing for people dealing with addiction. And my heart just sank. And I made a promise to myself that we weren't going to be in that situation the next time someone came up to me who was struggling with addiction. So we have launched our recovery center. We have Anna Cavoli, who leads that effort. We have substance use counselors in multiple sites, and we have a site that's just dedicated to helping people break free of addiction. I'll never forget the woman who came to me that day, and I pray for her.
At every encounter, medical visit, patients are screened for depression, anxiety, and substance use to help them see the hope and to help them see the other side that things can get better. Walking alongside people as they make change and helping them stay engaged and motivated through the end.
So today we continue to serve in the streets through our homeless outreach program. We have EMTs and chaplains and nurse practitioners and substance use counselors that go to homeless shelters, bridge underpasses of freeways, to tent cities. We treat homeless individuals who might have addiction. We also treat prostitutes or other people who make their living on the street, because God made every person, and every person who has a health need, we believe that need should be met.
Street Team is about reaching people who have burned their bridges. There are people that nobody, in a lot of cases, wants anything to do with anymore because of their addiction issues, because of maybe their mental health struggles. they've made themselves hard to reach. To me, what Street Team embodies is going out and saying, well, we see all that, and you can tell us no, and you can tell us to go away, but we're still going to be here and we're still going to look for you. Those women that are on the street, they don't see any way out. When they go out and talk to those women and offer them hygiene and a cup of hot cocoa and prayer, they're saying, I see you. I haven't forgotten about you, and God hasn't forgotten about you, and you are lovely. There's no one else that's telling them that. It's really beautiful. It's a really beautiful thing.
And we believe that meeting the needs of individuals in their most desperate situation in the name of Jesus is a way of calling them back to the community of hope, the community of health, the community of life.
The Covenant Joy Southfield site serves is in West Detroit. It's one of the most densely populated neighborhoods for children. It has maintained its overall population through the decade. It has a lot of churches, it has a lot of liquor stores, and it has no grocery stores.
Yeah, this is the place that we are going to build our new health center. We're so proud that it's here in the city of Detroit, that it's on the grounds of the former Herman Gardens housing project.
Our core values are humble, generous, and resourceful. We've learned that those are the values that Dr. Kleinert, Pastor Bob brought at the very beginning. And those are the values that our staff exhibit when they're at their best.
Some of the patients are just so grateful for the services that Covenant provides. They know that they would not be able to be seen anywhere else and get the kind of care that they get from the Covenant Community Care providers.
We have more than 20,000 patients. We provide more than 70,000 visits a year to those patients. We have 170 staff doing this hard work. In everything they do, they seek to treat each person as the one that Jesus sent to us today.
And it's a fulfillment that nothing else can give you, to be able to open the door for them when they thought every door was shut.
And in a Christian health center, you are challenged to give that precious dignity to every person that comes, no matter what challenges they face and no matter what challenges you're facing that day.
Margaret came in, she did not have health insurance. She did not think that she would be able to be seen that day at all. She was so grateful. From the minute I walked in the room, she started crying. She cried in my arms and hugged me. I was just so happy to be able to say that, yes, we can do this for you.
Over time, we've frequently come to a place where we felt we were safe and where the new thing that each program, the Morass site, the Woodward site, the Joy site, would maybe put us at risk. And the only risk that I can see for Covenant Community Care is deciding to be safe.
To be able just to provide spiritual care. I don't know any other office where you can openly pray with a patient and you don't have to hide it, you don't have to be ashamed, and you bring God in the forefront. I love Covenant. I love being a provider here. If I could choose to be anywhere in the world, I would still be here.